Welcome to Washington State. We've just finished very productive meetings with the Vice President. We in Washington are very appreciative of him being here today. He not only helped us with some issues today in our partnership with the federal government, but he has already helped us in recently removing some federal restrictions that would have made it more difficult to have testing for the coronavirus, which we appreciate. We had very helpful meetings talking about our ability to increasing the testing capacity for the virus in the United States. We had some great discussions about some of our unemployment compensation issues to help more people who might be quarantined to be able to have assistance. We had discussions about the ability to have additional surge capacity in our medical delivery system and our ability to have immediate help from the federal government with one of our nursing homes and other capacity. And I think that he has been very remarkably adept at fielding our inquiries, and I know he's going to go back and help to continue this effort. I also want to compliment his agency directors who have been assistants as much personally to me, giving us some additional scientific information. So I think we have a good partnership between the state of Washington and the federal government, and I'm very appreciative of him being here in such short order. Thank you, Mr. Vice President.
Thank you. Thanks, Governor. Thank you, Governor Inslee, and to your outstanding healthcare team, Dr. Weissman. It is good to be here. Washington State is on the front lines of the coronavirus in America, and the people of Washington State should be proud of your state and local leadership, the healthcare leadership, the first responders. The way you've come alongside families that have been impacted has really represented the very best standard of care, and all of America's hearts are with the people of Washington State today. Governor Inslee, as I told you, President Trump wanted me to be here to ensure the people of Washington State that we are with you and that the full resources of the federal government will continue to be brought to bear as people across the Seattle area and across Washington State deal with the coronavirus. I do want to commend Governor Inslee, your team's effort, and the seamless partnership that was forged from the very beginning between our administration and your administration here at the state level. Dr. Weissman just informed me that he literally speaks to the head of the CDC every day, multiple times a day. We've had personnel on the ground literally since the first corona case was detected here in Washington State. And President Trump wanted me to be here to talk to the people that are on the ground, the emergency center earlier today, to talk to policymakers here to ensure that we continue to provide that level of support. I'm also pleased to be joined by so many members of Washington's delegation to the Congress of the United States. The good news was today that the United States Senate passed, as the House of Representatives did yesterday, legislation that will provide nearly $8 billion in support. And I want to thank these members of Congress for their efforts, swift and bipartisan, exactly what the American people would expect in a moment like this in the life of our nation. The resources, Governor, as we discussed, are not simply resources for federal agencies, but rather there is also considerable investment available for states like Washington that are dealing with the coronavirus, and also local healthcare providers. And we're truly grateful for their efforts. We have, as the Governor just said, forged a strong partnership between the federal government and the state government, and we'll continue to look for ways to strengthen that in the days ahead. So I stand before you today. At this moment in time, we have at least 150 cases of coronavirus in the United States, including 70 confirmed cases in Washington State. Among the balance of those, some 49 are Americans that we returned home from China and from being on the cruise ship Diamond Princess. And of course, as we stand here today, our hearts grieve the loss of 12 Americans, and particularly to those families here in Washington State. Please know that you have the condolences of every American, and you're on our hearts for your loss. While the coronavirus has spread in the Seattle area and new cases are detected around the country every day, the good news is that the vast majority of all of those who have contracted the coronavirus are recovering and doing well. The truth is that the risk of contracting the coronavirus to the average American remains low, according to all the health experts that I have here with me today and that are a part of our efforts at the national and state level. And while there may be more cases detected in this state and around the country as we continue to expand testing, most cases, the experts tell me, will be mild, will have flu-like symptoms, and the Americans involved will fully recover. We have observed, as you have, Governor, here in Washington State, though, that seniors and Americans with underlying health conditions are particularly vulnerable to serious disease, and especially following the heartbreaking loss of life at the nursing home in Kirkland. We've taken action to address that, just as you have here in Washington State. The director of the Center for Medicaid and Medicaid Services, Seema Verma, is with me today. And this week, at President Trump's direction, we raised the standards for all nursing homes in America with regard to guidelines for preventing the spread of infectious disease. And also at the President's direction, all 8,000 of our inspectors at CMS nationwide will be focusing all of their inspection efforts at nursing homes on compliance with federal standards for preventing the spread of infectious disease. We want to make every effort to ensure that our seniors in our nursing homes are as safe as possible from the spread of the coronavirus. And on the subject of testing, we've been making steady progress. And I was encouraged to hear, Governor, that CDC has been able to provide kits to Washington State to meet your demand, but we know that while we're meeting the demand of cases we know about today, we still have a ways to go to ensure that tests are available for any future cases and also for people across your state and across the country that may be concerned that they had contracted the coronavirus and want to obtain a test. But I'm happy to report and have you confirm that the CDC has prioritized the delivery of coronavirus test kits to Washington State and to California, and I can assure you, Governor, we will continue to do so. But by the end of next week, CDC's test supplier, a company known as IDT, will distribute kits across the country that will enable roughly 1.2 million Americans to be tested for the coronavirus. Those kits will be delivered in just a matter of a few days. By the end of next week, another 4 million tests will be available. But it's still just a beginning as our nation continues to hear of new cases every day. We want to make sure that testing is available broadly. And to that end, President Trump brought together the leaders of the top commercial labs in the country. And as we speak, at the President's urging, they have formed a consortium and will be working with the leading commercial labs in America who tell us that in a matter of weeks, through validation efforts that we'll do through the FDA, they could well be in a position where in the not distant future, your doctor, your local pharmacy, your local med check will have access to a coronavirus. We have a ways to go, but President Trump said early on that we would bring a whole of government approach to confronting the coronavirus, and we have. But as the President met this week with the leaders of commercial laboratories, with the leaders of pharmaceutical companies, with leaders of other industries, the truth is we're bringing a whole of America approach to this. and American businesses are stepping up in new and in renewed ways to make sure that we have the resources, including the testing and the development of therapies, and ultimately, in a year and a half, we hope the development of a vaccine for the coronavirus, and every American should be grateful for that. With regard to the tests themselves, once again, CMS has already made the changes necessary that a coronavirus test is today now eligible for coverage under Medicare and Medicaid, and we'll be working with these members of Congress to ensure that coronavirus testing is included as an essential health benefit and therefore is covered by all the private insurance in the country as well. There may still be gaps. We'll work with policymakers to ensure that the coronavirus is available for anyone who is concerned or is suspected to have been exposed. But we're making great progress in ensuring that this test is available broadly to people across the country. For up-to-date information on the status of the coronavirus, on best practices for preventing its spread, keeping your own health and your family's health secure, you can go to coronavirus.gov for the latest information from the Centers for Disease Control. Our message to families all across the state of Washington is simply this: we're with you. We are here to help, and we're going to stay with you every step of the way until the state of Washington and America sees our way through the coronavirus.
爸，你会填2020年人口普查吗？
人口普查？
对呀，每10年一次，重新统计住在美国的每个人。这些数据有助规划公共资金，决定分给学校、诊所、收入等的比例。学校教的。
真好，但是爸爸现在没时间。
爸，很重要，我们一起上 2020census.gov， 说不定还能改善交通呢。
那爸感兴趣。
详情请上2020census.gov。